Hello everyone, and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor of nursing practice. Today, we're exploring a connection that's often misunderstood: testosterone and depression. First, let's break down the basics. Testosterone is a hormone found in all bodies, though men typically have much higher levels. It's essential for energy, libido, muscle strength, motivation, and even brain function. It's produced mainly in the testes for men, and in smaller amounts in the ovaries and adrenal glands for women. Now, what is depression? It's not just feeling sad. It's a medical condition that affects your mood, your thinking, and your ability to function for at least 2 weeks. Common symptoms include a persistent low mood, losing interest in things you once enjoyed, crushing fatigue, changes in sleep or appetite, and feelings of worthlessness. Depression is complex, with roots in genetics, stress, trauma, and medical issues, including hormonal changes. So how does testosterone fit in? It influences our brain's reward systems, including dopamine and serotonin pathways, which drive motivation and pleasure. When testosterone is low, it can cause fatigue and a flat feeling that can mimic or worsen depression. Testosterone is also tied to sleep quality and metabolism, and we know that poor sleep and metabolic issues are strongly linked to depression. It's a complex cycle. Chronic stress can lower testosterone, and low testosterone can make it harder to cope with stress. Clinically, the link is real, but it's not simple. In men, especially as they get older, low testosterone is often associated with depressive symptoms. If a man has true hypogonadism, meaning consistently low testosterone plus symptoms restoring his levels to a normal range. But here's a crucial point: if your testosterone is already normal, taking more isn't a reliable depression treatment and can even be risky. For women, the evidence is less clear. While very low androgens can affect energy and well-being, testosterone isn't a first-line treatment for depression and must be used with extreme caution. This is why a proper evaluation is so important. The symptoms of low testosterone and depression, like fatigue, brain fog, and low libido, overlap significantly. But these same symptoms can also be caused by other issues like sleep apnea, thyroid problems, anemia, or even high stress. A lab number alone should never be the only reason for treatment. So, what's the safest and most effective approach? We address depression directly while also looking at any hormonal or medical contributors. First, treat the depression itself. Therapy, like CBT, is highly effective. Lifestyle changes are also powerful. Regular exercise, especially resistance training, getting morning sunlight, and reducing alcohol can all make a huge difference. And of course, antidepressant medications can be incredibly helpful when needed. A top priority should always be sleep. Poor sleep can drive both low testosterone and depression. Second, if appropriate, get your testosterone checked correctly. This usually means a blood test first thing in the morning, often repeated to confirm the result. A good workup will also look at other hormones and potential underlying issues like vitamin deficiencies or thyroid function. Third, we correct reversible causes. Before jumping to hormone therapy, it's vital to address things that can suppress both mood and testosterone. This includes untreated sleep apnea, excess body fat, heavy alcohol use, and chronic stress. Improving your activity level, especially with strength training, can boost both mood and testosterone signaling. Finally, testosterone replacement therapy, or TRT, is an option for the right person. It should only be considered when there's a confirmed diagnosis of low testosterone with matching symptoms, and after other causes have been ruled out. It must be medically supervised due to potential risks, like changes in red blood cell count, acne, and in men, it can affect fertility. For women, testosterone use is even more specialized, requiring careful dosing to avoid side effects. The bottom line is this: testosterone can influence mood, but it's not a universal cure for depression. The best results come from an integrated plan. Treat the depression directly, evaluate hormones thoughtfully, fix underlying lifestyle and medical factors, and use hormone therapy only when it truly fits the clinical picture. If you want to learn more tools to support your mental health, I explore these topics in depth in my book, Through the Storm: available on Amazon under my name Maria Padad DNP. If you found this video helpful, please give it a like, share it with someone who might benefit, and subscribe to the channel for more insights on healing your body and mind. See you next time.